Okay, let's talk a little bit about music therapy and the effects of prenatal and postnatal music exposure. This is just going to be a brief introduction here. So, our knowledge of music development can inform music teaching, and it should inform our music teaching. Studies have been done on music development in the fetus, infant, and young child, and boy, do we need more studies on this. And it is important to know how and when development and learning takes place before trying to bestow our knowledge on young children, because perhaps we have some learning to do of our own first from them. So when it comes to the auditory system and its development, first of all, please look more into this. I strongly encourage a search on the auditory system of an infant. There is much to be learned and much more than I can include in any slideshow. But it is no mystery that development of the auditory system of a baby or very young child is significant. What is perhaps even more critical is the auditory development of a human being in utero, also referred to as a fetus. When a mother is about 25 weeks pregnant, the auditory system of her baby has already been developing. Let me say that again. 25 weeks pregnant. That auditory system has already been developing. Graven and Brown explain that the auditory system requires auditory experience with voice and language, music, and meaningful environmental sounds during the last 10 to 12 weeks of fetal life, and that's 28 to 30 weeks gestational age, whether in utero or in a newborn intensive care unit, also referred to as the NICU. Now, it is not uncommon for expectant parents to talk to their baby while in utero or even read to their baby. Sometimes parents already sing to the unborn baby. But what is not common is the knowledge of the vital role that singing, speaking and reading, and exposure to sound plays in the very early weeks of life. The auditory system needs to be stimulated and in certain ways in these early weeks and in utero so that proper development occurs. And we're talking super critical here. In utero, the hair cells that are turning to high-frequency sounds are protected from intense high-frequency sounds, but are exposed to low-frequency sounds that permit fine-tuning of the hair cells. Some fancy talk, but we'll keep going. Studies show the significance of hearing development very early in life and the specific ways in which parents can both support and protect this development. That's what they're talking about in that quote. The fine-tuning of the hair cells. Those hair cells, that become these little babies' ears, their auditory system. It is developing. The fine-tuning of the hair cells is their development of their auditory system. And there are specific ways in which parents can support and protect this. Exposure to certain frequencies, like listed above, high frequency, low frequency, knowing the difference, knowing what it involves, super important. Decibel levels, and the incorporation of deep sleep even are all factors in development. Research also suggests that infants can recognize a melody, sound, or music heard while in the womb. Some studies even go as far as suggesting that this could be considered fetal memory, as in a fetus is able to form memories while in the womb that can be recalled or recognized after birth. Just think for even a brief moment about applying that to our music teaching. Imagine walking in to a music classroom in kindergarten, a general vocal music classroom in kindergarten, and assuming that all or most of these children don't know anything about music. Now, is that exactly true? Sure, it depends on their exposure to music, exposure to sound. We don't know their backgrounds yet. But we kind of assume that they don't know much, that we have to give them all this knowledge on music. And while we do often need to catch them up on music exposure, their auditory development starts in the womb. So in reality, we are far behind in music exposure potentially. Or we're coming in and teaching them perhaps what they've already heard. You never know. Just think about it. Several studies exhibited the effect that music therapy had not only on babies, most if not all in the NICU, born premature, but also had a great effect on maternal fetal attachment, maternal infant attachment, and attachment between father and baby. Music therapy promotes attachment in all three ways. Start thinking about these music therapy techniques and what you'll learn and what you're about to observe and see, and how these music therapy techniques and knowledge can inform our teaching. Stress that mothers feel while pregnant directly affects the baby. Research shows that music can help alleviate that stress during and after pregnancy. Some studies even found that soothing music helped to minimize pain during labor. Music therapy sessions backed by research have revealed great benefits to premature infants. Premature infants who continue to struggle with feedings or with learning to suck, swallow, breathe showed improvement in these areas with the help of music therapy. The heart rate, sound environment, and overall stress level are all vital components in a premature infant's life. Music therapy can also assist in managing these components. Again, tie it back to music teaching to give it some thought. Okay, so I'd like you to take a moment, press pause if you need to, and click on each link for the YouTube videos, and please watch each link to the end. And later you will reflect on these videos and we will discuss them. But for now, even though some of these videos have a few of the same elements, they each have something a little different to offer. So please make sure you do watch all 4 of those videos. So we should just leave it to the medical and health professionals, right? I mean, music therapists should just do this. We are music teachers. We don't need to worry about this. We don't need to take anything from this except, sure, their ears warm. They can hear. As long as their auditory system develops correctly, then we don't need to worry about that stuff. No, not a chance. I don't think so. Most research does come from medical or science journals, and a few come from music therapy journals. But there's studies from all over the world: Germany, Ireland, Turkey, Netherlands, Austria, UK, Finland, Australia, France, Taiwan, Canada, United States, and Norway. Here's the key. The research should inform teaching and effect practice. Again, the research should inform teaching and effect practice. Development of the auditory system is a critical part of growth and begins in the womb. And the time after a baby is born is also critical for growth and development. Starting music exposure and teaching in elementary school means that several years have already been lost in training a child's ear. The wealth of knowledge found in this research and its importance needs to be spread to researchers, teachers, music and non-music, to be honest, and expectant parents. But as music teachers, keep this in mind. This knowledge should inform teaching and affect practice. I can't stress that enough. So again, learning about the effect of music at or before birth, as well as in infancy and beyond, should further demonstrate the importance and benefit of music in early life. It would be in children's best interest if music teaching, or rather even guidance in music, happened even earlier than it already does. If research could inform teaching and guide curriculum planning, findings should discontinue the elimination of music programs in elementary schools, at the very least. In addition, primary music programs should be required. At this point, this really is not well-known information. Expectant parents should be made aware of the benefits of introducing music even before birth. Just as birthing classes and prenatal yoga are generally known to be beneficial and important and are commonly advertised to expectant parents, so should prenatal and infant and early childhood music classes. More research is definitely needed in this area, especially in the area of music or melody recognition from prenatal exposure to postnatal hearing. The United States unfortunately lacks this research compared to the amount in other countries. Research leads to more knowledge, the likelihood of stronger confirmation of previous findings, and a greater possibility of this knowledge reaching people. So go be a teacher, an informed teacher who has this information and it affects your practice. Go be a teacher. Go be a researcher. Go find out more. Learn all that you can and let it affect your teaching, your practice.